you're going to find way more people who have explosive on switches who don't feel bad. Okay, the people who show up feeling bad have explosive on switches, and the reason they came to see you is because they have broken off switches. So once they turn it on, they can't turn it back off, right? So I tell them about the on switches, and I even draw this out, and I say, listen, I know that you're going to have explosive on. I could ask you how big your mosquito bites are, and I could guess it. But when you have broken off switches and you can't turn it off, it just keeps coming at you, and there's no way to shut it down. So the nicest and easiest way to tell if a person has potential broken off switches is asking one simple question. Do you have good days and bad days? Because inflammation is not a steady state thing, depending on what you got exposed to. You understand? And neurologically, because that's what I focus on, if this is going on, there's no way for my body to adjust. There's no way to accommodate, because I don't know whether I should accommodate for the good or the bad. So your job is very simple. If they have broken off switches, let's give them alternative off switches. Make sense? I add a new one, SOCS1. I want you to look at this. The SOCS1 is a member of the STAT family, signal transducer and activator. Here's what's interesting. It was just proven that Epstein-Barr virus contains the entire genetic makeup for a faulty SOCS1. So I'm going to have to tell you that I was wrong. I used to think that Epstein-Barr was just there because somebody had chronic fatigue. If you didn't feel good and had inflammation, Epstein-Barr showed up. But now I got to swallow my tongue and tell you that Epstein-Barr can cause chronic fatigue because it makes a faulty SOCS1, suppressor of cytokine signaling. So if you can't suppress cytokine signaling, you get chronic inflammation, and how good do people who are sick all the time feel? Fatigued. Make sense? STAT4, tumor necrosis factor, CTLA4, and DRD2 is thrown in there because it'll tell us about naltrexone response and how effective it may be should we ever need it.